Welcome to the Menopause and Cancer podcast, where we speak with cancer patients, survivors, and incredible experts in their fields to help us find solutions to our symptoms and ideas to improve our health. My name is Danny Binnington, and today we want to talk about what every survivor needs to know about her skin and hair. Many people say to me, my skin, the appearance of my skin and how I feel in my skin has really changed since my cancer treatment and since the onset of menopause. In the old-fashioned days, people might have even said, I feel like a prune. My skin is so dry, my skin is so wrinkly. And we want to also talk about how we feel in our skin, but what we can do to feel better in our skin. There are lots of brilliant cosmetic brands out there, and I often myself, I'm so confused. Are these products worth the money? Is it all a hype? There are lots of menopausal products on the market as well. Is it a bit of menowashing? I really want to talk from our expert today. Where do I need to spend my cash and where do I save it? And what are some super amazing tips and tricks and hacks? Dr. Mandy Leonhardt is the author of 2 incredible books. Her second book, What Every Woman Needs to Know About Her Skin and Hair, really dives deep into, if you've ever wondered how your hormones affect your skin, then really this is your deep dive book. And she talks about everything from puberty to reproductive years to pregnancy to perimenopause and menopause. And I really want to know from Mandy a few different topics. There are lots of things we can discuss, but for today's purposes, because I really want to get things right, we're going to be talking about cleansers, what to do, what not to do, moisturizers. We're going to be talking about things like retinol and collagen. So the things where we could spend a bit of money on, the serums. Are they worth the hype? Do they work? What strength? Really get into the nitty-gritty of those. We're also going to be talking about sunscreen, magnesium, and I want to know from Mandy some really lovely, inexpensive tips, nutrition-wise, that can also really help with skin. Mandy has turned over every research paper there is to understand how our hormones affect our skin. And so she is really the best expert to help us talk about this. We'll also talk about some medical treatments, of course, because when we talk about skin, we've got to talk about it all. This is one conversation of many. I can't wait to have it. So let's welcome Dr. Mandy Leonhardt onto the show. How are you today?
I'm very well, Danny. Thank you for having me. It's very kind to invite
Mandy,
me.
it's fantastic. This is the second book that you have written. And I just said to you in the pre-chat conversation, your first book, The Guide to POI and Early Menopause, which you have written with your colleague and friend, Hannah Short, Dr. Hannah Short, is an absolute Bible. And I'm going to link it in the show notes here. And your second book, What Every Woman Needs to Know About Her Skin and Hair, is absolutely fantastic. Can you show us the fantastic yellow cover? It's just such a great book. And if anyone has ever wondered how hormones affect their skin, hair, and nails, this is a really, really good book to dive into. What prompted you to write this book, Mandy?
So, to be honest, in our first book, I already wrote the chapter or the bit where women. So, our first book that you kindly mentioned, The Complete Guide to POI and Early Menopause, we had a head to toe section. So, we went, all the things a woman or a girl could experience who is in early menopause or has POI in terms of symptoms. And one of the sections was skin symptoms, and they're very common: dry skin, itchy skin, formication, so and crawling sensation, and so on. And I realized, wow, the skin problems are really common, and they are really affecting the quality of life. And so I researched that bit, and I wrote this section in the book about skin and hair. And then I went down a rabbit hole. So I then was more and more fascinated about, and I thought, so estrogen has an impact on skin and hair, testosterone has an impact, progesterone does. And then I thought, wow, this is never mentioned in terms of, how the way our hormones change through our life cycles. How does it affect our well-being, not just well-being, but the way we look and our skin and hair, how it feels, and how we are prone to certain skin conditions throughout our lifetime. And because the female life cycle is not stagnant, it's very dynamic. We we go through puberty, then our hormones change throughout the menstrual cycle every single month, if we are lucky to have a menstrual cycle. Then it changes again during pregnancy, in the post-pregnancy phase, and then we have the perimenopause and the menopause. So all of these hormonal changes affect our skin and hair, but then you also have to factor in that hormones do not just interact on their own. They also have an interplay with each other. So thyroid hormones, cortisol affect skin and hair, growth hormones, insulin. There's so many hormones that have an impact on skin and hair. And then I really dug deep into the way the skin works, and I realized the skin itself is a hormone producing gland, and it interacts. There's a direct connection between the brain and the skin, so it's called the skin brain axis. So it is much more complicated than I ever thought, but I really found it very fascinating to dig really deep into the way our hormones interact with the skin, but also how the brain talks to the skin. And then to top it up, you have a gut skin axis as well, so the gut interacts with the skin. And then you also have the skin's own microbiome. We all know about the gut microbiome, but we have so much research now about the skin's own microbiome, so a little bit of the little bugs and little creatures that live symbiotically in our skin, or sometimes they are harmful, but mostly they're beneficial, and they are very much interacting with hormones as well. So it's super fascinating. To cut your question short, yes, so that's how I got to write it, because no one in my what I've seen, no one has ever written about this before in a book. We've got studies, but journal papers by doctors, but no one has ever summarized this in a book.
Yeah, and that's why I think it's so fantastic, because I was just saying to you earlier, we had over 115, 20 podcast episodes here, and I've never spoken about skin and hair. We have spoken about hair, but we haven't spoken about skin and nails, because I always found so many people are connected to products, people are connected to brands and supplements, and although so many people have amazing products and brands and supplements, I always really wanted to know what are the facts. And one thing I do know is, so many workshops I'm on, so many people I meet, people say to me, gosh, I just feel like I've aged so much. People say, what's happened to my skin? My skin is wrinkly. I can't even recognize myself anymore. And it's all happened really quickly. So many people might have embarked on their cancer treatment, their chemotherapy, and then they sort of emerge into this cancer survivorship land, whether they can have HRT or no HRT, whether they're on aromatase inhibitors or tamoxifen, or whether they're in surgical menopause. We're all in these different sort of landscapes of menopause, and people really struggle with their skin, and it comes with the emotional burden. People often say to me, gosh, I hate the way I look now. What's happened to my skin? I don't recognize myself. But we also feel we should be so happy that we've survived, and it shouldn't matter what we look like. But it does matter, because we see ourselves every day. And so there's a bit of that emotional conflict as well. We don't like what we see, but we feel like we should be grateful. And, we know it's a privilege to survive. And then you have the whole aging conversation, isn't it? Like, what is pro-aging, aging with grace? You have all these terminologies out there. What have you sort of embarked on in the research of your book about aging and skin?
Yeah, so as a woman, whether you've got cancer or not, or whether you've had a history of cancer or not, you can't win. You always lose the kind of game of aging, because let's say if you do embark on more invasive treatment like a facelift or fillers or Botox, then it is very noticeable. You may feel better, it may make you feel better, but at the end of the day, if it's done badly, people can tell, and then you might just not look younger, but you might just look odd. Now, that's not to blame anyone who wants to do that, because I support every woman who wants to do this, but you can't win. Whether you have treatments, then they may say, oh, look, she had treatments, she didn't age gracefully. But on the other hand, if you do nothing and you just leave your skin naturally and do not cover up blemishes, and you're just au naturel, then again, it says, why didn't she just cover it up? Why can't she just do something about her skin and the wrinkles she has? You cannot win. And if you really look at it, you only have about 25 years, maybe 30 years, during which, if you're lucky and you've not had, for example, scarring acne or something, that's the best time when it comes to skin. Actually, collagen breaks down from age 25 slowly, and then there's a massive breakdown after you lose estrogen. But this is a very, very short time frame when people perceive you as being young. But why can't we just accept that we will not have the same skin age 50 as we have age 25? You know, we cannot look 30 years old when we're 60. It's just odd. But why is there these expectations in the first place? And I think I'm all for healthy skin, keeping your skin as healthy as possible. And if there's something that bothers you, that's absolutely fine to do something about it. You know, if you've got a deep frown line here or a deep line across your forehead, you know what? Botox has been around a long time. It's super safe. A skin cream will not likely get rid of a deep set line, which is no longer dynamic, but actually is set, you know, which no longer goes away when you relax your face. So just have a bit of Botox. It's very safe. It's not harmful. It wears off. Fillers is a bit different, you know. The early fillers were a problem, but if you are under the care of someone who knows what they're doing and you can afford it and it does make you feel better, I think you should, you know, just go for it, you know, and do your research. But as long as it's safe, I think women should not justify why they do something or why they do not do something.
Thank you so much. I recently had a conversation with a friend. I really love your answer so much because my friend just said to me, we talked about Botox and things like that. And she said, look, if you have it done, you're judged because you're having it done. And if you don't have it done, you're doomed because we know women don't get jobs in media, on television. We see it with a lot of the movie stars in America. They just don't get put forward for roles and they're publicly judged for not going down the invasive sort of treatment route. And there was a really amazing picture very recently, and it had Renee Zellweger, you know, in the old Bridget Jones movies. And it really just showed how she wasn't allowed to age, how her face and everything is really sort of, it almost looks like, you know, 30 years ago when the first sort of movies, or 20 years ago when the movies came out. And when you look at the male counterparts, they're very much allowed to age and they have lots of lines, and we allow it for we allow it for men, we don't allow it for women, and we are in a really tricky situation. And I think all we can appreciate that you can have lots of conflicting opinions and emotions around this, isn't it? I wake up very, very many days and I really dislike my crow's feet. I really dislike what I see, and it's an effort actually to tell myself it's okay, you can do this, it's fine, you don't need to do anything that you don't want to do. But I also, it's effort, I have to work on that. It's a conflict, almost
I agree,
internal
because
conflict.
I mean, if you are a very active woman who's got a really good insight and you do pay a lot of attention to your lifestyle, your nutrition, and you feel, let's say internally, you feel younger than you look, and if there is this discrepancy between that, and if that affects your confidence, or if you identify that one particular thing like crow's feet, for example, or if it's something that really bothers you time and time again, I do not feel it is problematic to address this, you know, because even if they don't go completely, there are certain treatments like lasers, resurfacing, or certain chemical peels, or Botox, you know, which is really safe actually, that could take care of just that one single area. You do not have to kind of have a top to bottom, you know, rejuvenation treatment, but often it is just one small little area. For example, I had a really good friend who had a blepharoplasty, which is eyelid surgery. She had, since she was pretty much born, she had very droopy eyelids. That was just genetically, she was born like that. And she always looked very downcast, very depressed, very as if she wasn't awake. You know, her eyes were kind of, her eyelids were quite droopy. She couldn't have Botox because that would have made it worse potentially. So she decided to have, under local anesthetic, privately, with a very good surgeon, she had that little bit of skin above her eyelids, trimmed. And when I saw her again after the surgery, and it had all healed very quickly, she looked like a new person, and she looked for the first time the way she wanted to look. And it was, you couldn't see she had surgery. She just had normal eyelids like everyone else, and she looked just like she had a good night's sleep. And you know, that was something that she she felt so, it wasn't that there was nothing she could have done lifestyle wise to improve this, and sometimes you have to do these things as long as you're safe, and I don't have a problem with that at all.
I didn't expect our conversation to go where it's going, because I've got a whole list of I've got a whole list of things I want to cover, and I want to really myth bust with you, but I'm so appreciative that you have such an open mind. I can't tell you how wonderful it is for you to give permission to really explore what it is that we want to know about, or what it is that we want to embark on, and not to judge ourselves, because I think sometimes it's not what other people do, is we judge ourselves. Like, I judge myself for having these thoughts. I judge myself for maybe thinking, shall I have Botox? I judge myself, and I wonder if people at home also judge themselves. And I love when you talk about the discrepancy of how you feel, and then when you look at yourself in the mirror, you think, oh my gosh, I don't feel like this, but I can visibly see. And in the menopause space, we have, sometimes with women, we have a bit of a joke. We're like, I feel like a bit of a prune. Like, my skin is so dry, I feel a bit wrinkly, I feel like, for especially the women who are really, where they are no estrogen, they feel really sort of like the estrogen is sucked out of their body, and their skin feels like that as well.
Well, unfortunately, this is true. What they feel is actually very true and based on fact. So if they say, I feel my skin has become very dry since I am using tamoxifen or aromatase inhibitors, or since I have had a hysterectomy with my ovaries removed, or since really estrogen has left the building, this is very, very true. And it is not in their mind. They're not making it up, because we do know how important estrogen is for skin health. So estrogen increases water, moisture levels in the skin. It increases hyaluronic acid. It also prevents fibroblasts from dying off. It increases collagen production in the skin. And we have to remember, collagen is also in our bones. So we know that within 5 years, let's assume a woman has a natural menopause. Let's say she's 50, her periods stop. Within the first 5 years after menopause, where she has very, very low levels of estrogen naturally, a natural event, she would lose up to 30% of her overall collagen. So that collagen, it's not just in the skin and hair, but it's also in your ligaments and your tendons. So the collagen shrinks, it disappears. 30%, a third of our overall collagen is lost in the first 5 years after not having estrogen. But also we can see a connection between bone health and skin health, because we also lose potentially up to 20% of our bone mineral density after missing out on estrogen. It all depends where you started off, and genetically it plays a huge role. So there's three variables here. There's genetics, there's lifestyle, and nature versus nurture. So it's genetics and lifestyle, how we age. If you're lucky and you have amazing genes, then you start off with really good collagen, and it won't be visible if you lose a little bit. But if you are unlucky to have a sort of genetic makeup that makes you lose collagen very fast, or you have a different connective tissue, then it will be more noticeable. So there was a very famous researcher called Fuller Albright in the 1930s. He's for the first time made the connection between thin skin and thin bones. He has noticed that the women who had very translucent, very thin skin, because they were on certain medication, when they checked their bone mineral density, they found that they were much more likely to have osteoporosis. So it is an all-encompassing problem. It isn't just relating to the skin, but when you say women, who are going through breast cancer treatment, who have very much a sudden drop in estrogen, it's not in their head. It's entirely normal. It's what would happen, because you see a shrinkage in skin thickness and loss in collagen, and exactly that results in wrinkles shortly after. But saying that, it does slow down after 5 years. It doesn't rapidly continue like that. It does slow down. And there's loads you can do as well.
Yeah, and that's what I love so much about your book, because you have really done the research for everyone. You have turned over hundreds of research papers and studies, and you've included them, and that's so wonderful. you are acknowledging what women are experiencing is why it happens. And then you work with us to help us understand what practical tips we can implement. And, I really love that you are talking about a whole range of treatments. You're talking about skincare ingredients, you're talking about supplements, you're talking about lifestyle, nutrition, you're talking about so many elements all the way to medical treatments. And I think to me, that was very sort of like all encompassing. It's almost like if you've got menopausal skin issues, you've just got to read the book and there will be lots of options for you. And in a way, Mandy, it's a bit like what I wanted to do and set out with the podcast. I just wanted people to know they've got loads of options, and whoever they are and whatever their past is and whatever their belief system is or their medical situation is, there'll be something in these conversations for everyone. And I feel like we have to have loads of conversations with you because I know we can't tackle it all in this one conversation. But can we start a little bit with what we all do every single day, and that is putting a moisturizer on? I think by now everyone knows we should also moisturize our vagina and our vulvas because we talk about
absolutely.
sexual health all the time. But to talk to me a little bit about the basics. So when I moisturize, because I do that every day, what do I need to look out for? And then we also talk about cleansing a bit, if you don't mind.
Yeah. So I think let's start with the cleansing first, because there is this kind of craze to think that you have to cleanse, 3-4 times a day, or that even that you clean your skin using a cleanser twice a day. So I think more problems are caused with over cleansing than if you weren't cleaning your skin properly. Of course, when you wear foundation or makeup, you need to take that off at night. But you absolutely, once you've done that and you go to bed with a clean face, you do not need to use an actual ingredient other than water to clean your face in the morning. There's no need to use a cleanser in the morning, because actually the more you cleanse, the more detergent, the more chemicals you use to strip off the healthy microbiome and the skin barrier, the more harmful it will be for your skin. Just leave it alone. Just use water in the morning and then put your moisturizer on. But in the evening, what you want to use is ideally, if you do wear sunscreen or makeup, there's evidence that an oil-based cleanser gets rid of most of it. It works the best. So they did a study with just water, with a water-based or gel-based cleanser and an oil-based cleanser, and they found that the oil-based cleanser was most effective to reduce up to over 90% of the sunscreen and makeup. So it also is really good for dry skin. So I quite like a cleansing balm, an oil-based balm. So you have it in a tub or it's a solid, and you scoop it out. You massage it in your warm hands, and then it's really important that you put it on dry skin, not wet skin. So an oil-based cleanser has to be applied on dry skin, because water and oil repel each other. So if you moisten your face first, it won't work. It won't lift off the dirt. It won't dissolve it. So please do, if you have an oil-based cleansing balm, use it on dry skin. It sounds counterintuitive, but and then you kind of spread it out. You massage it gently, and that will lift off the dirt, dissolve the dirt, and then you take a warm flannel, not a cold flannel, not a hot flannel, but a warm flannel, ideally, or like a cotton pad, and take it off. So you physically then remove the dirt and the cleanser. I don't have a problem. This double cleansing craze, is it really necessary? Probably not. But if you do feel a bit oily after you've used your oil-based cleanser, I don't have a problem if you then go over the face again with another flannel, or even using a sort of a toner or something. But usually they do more harm than good. And then in the evening, what you would then put on your skin is a good moisturizer. And moisturizer, the key message here is, an expensive moisturizer is not better than a cheap moisturizer. Use a moisturizer that is right for your skin, so that isn't too greasy, but greasy enough to give you the moisture, and that also feels pleasant. So yes, the more expensive moisturizers you can buy, what they work on, why women like using them often, is because the companies spend a lot of money in optimizing the texture, the fragrance, and how it sinks into the skin and how it feels on the skin. So this is often what you pay the money for, not the quality ingredients. They're still quality ingredients, but you have a certain emotional association with a moisturizer, and it needs to feel good on the face. It needs to sink in and not leave a greasy film or peel off or something. So it does take, I cannot tell every woman who is listening or any free listener what specific moisturizer you should be using for your specific skin, because I don't know what your skin's like and I'm not your personal doctor. But do not dismiss cheaper moisturizers outright. What I'm not a big fan of is aromatherapy in moisturizers. I know this has a place in other alternative treatments, but they're often quite sensitizing. So I personally have made my peace with fragrance-free moisturizers. If you have very sensitive skin, often, so the fragrance doesn't always enhance how the moisturizer works. It can. Some fragrances have actually shown to enhance the way the moisturizer is absorbed, but it's quite difficult. But if you've got very sensitive skin, then I would say just detach yourself from the fragrance. So you open the tube, and you smell it immediately. Every woman does that. You go to some kind of drugstore counter, you open the lid, you smell, and if you don't like the smell, you're not going to buy it. Fragrance sells beauty products. It's as simple as that. But if you've got sensitive skin, you might go for the fragrance-free one. If you don't have sensitive skin, you can use any moisturizer that you like the smell of, and if it works for you, do it. The ingredients that they use, whether it's expensive or cheap, are very, very similar. They use glycerin, they use emollients, they use, and then they put some active ingredients in that are supposed to enhance the experience, but also make it more anti-aging. So they put retinol in, they put antioxidants in, hyaluronic acid. The problem with any of these products is that often they don't declare the percentage of what they put in. So you don't know, is it just a tiny, tiny bit that doesn't have any impact on wrinkles, or is it quite quite a high percentage which actually actively changes the skin structure? But often, if you have an active like retinol or tretinoin or retinoids, if you put a percentage into a cream that actually makes a significant impact to your skin, then it should be classed a medical product, because it's no longer a cosmetic product, right? It's actually a medical product. So these pharmaceutical companies, and it will have side effects. So pharmaceutical companies have to declare the side effects. Cosmetic companies do not. So there's this overlap between cosmeceuticals, so medical grade cosmetic products, which is actually, again, if they put the ingredients in the strength that they use, they're probably more beneficial than those products where you don't know how strong the active ingredient is. But going back to moisturizers, to be fair, don't look for miracles in a moisturizer. Moisturizer is exactly what it does. It says on the tin. It's supposed to increase the moisture in your skin, make it feel less tight, and make it a little plumper. But it's a very short-lived effect. Most moisturizers will not have a significant anti-wrinkle effect on its own. And there's nothing wrong with using a moisturizer as often as you need in the day if your skin feels very tight and very, very, very sort of dry. You can use it as often as you like. But in the evening, I would say, if you want a real anti-aging product, then focus on retinoid-based products. So retinol or prescription strength retinoic acid. But if you don't want that, then put your moisturizer on in the evening, a slightly richer moisturizer maybe than in the morning, and then let that sink in. And on top of your moisturizer, put some Vaseline on. And I know this sounds horrible, but Vaseline has such a bad press in some people's minds. In some people's minds, Vaseline is just the worst of the worst, and it's a petroleum liquid paraffin, and isn't it toxic? No, it isn't. It has been studied in over 1,000 clinical trials for safety. The Vaseline that we can buy in the tub, and I'm not, by the way, affiliated with the company, or I'm not selling it. It's very cheap. It has been filtered and purified to a medicinal grade before they can sell it. So it's a single ingredient product that has been shown in clinical trials to prevent water loss overnight, transepidermal water loss. And that's exactly what you want. You want to put your moisturizer on that makes the skin nice and plump. And then you put a thin layer of Vaseline on top around your eyes or the areas where you typically get quite dry in the morning. And what the Vaseline does is occlusive, so it traps the moisture in the skin overnight. We do experience quite a lot of water loss at night when we sleep. So often we wake up with dry skin, red skin, inflamed skin. And if you want to prevent that, put your Vaseline on top of whatever serums or active ingredients you've put on before, and then go to bed with your little bit of Vaseline on top. You don't want to do that in the morning because obviously it's greasy, it doesn't look right. But it's difficult to put makeup on and so on. But in the evening, I would say I'm a big fan of Vaseline, and I honestly believe it. I did not believe at first, but when you actually read the research, and to this day, I believe not a single person has been diagnosed with an allergy to Vaseline, because it's a single ingredient which doesn't go in, it doesn't actually penetrate the skin. It sits on top to prevent water loss, and that's what it does. It's a very simple moisturizer. So that would be my tip as well. And do not clean too much. Only clean when it's necessary. Leave your skin alone the rest of the time. Only clean in the evening, but only use water in the morning and a cleanser in the evening.
I absolutely love this. I never thought we would be talking about Vaseline today. I mean, that's absolutely brilliant.
And it costs nothing. It's very cheap.
Yes. Yeah. But I do want a little bit of that magic fix. So I know we talked about the cleansers and the moisturizers and the Vaseline, but I would love to know what products can I use that might help me with my crow's feet, that might help other people when they look in the mirror and they feel I've got really wrinkly skin. And you've mentioned a little bit serums. They are really expensive. You mentioned retinol or retinol, which I don't know how you pronounce it exactly. And so are those our magic sort of ingredients or not either?
Yeah, so a lot of companies have an ingredient that they sell as magic, but that doesn't keep the promises that it sells or it did. So for example, if you have a moisturizer where it says on the label, with hyaluronic acid or with an antioxidant or whatever, what basically delivers the very short-lived sort of improvement in your fine lines and wrinkles is probably the moisturizing ingredients in there, but it's not an actual reversal of your wrinkles, because the skin is a barrier, and it really is designed to stop things from going inside. It's our outer sort of shell, and its whole purpose is to keep things out. So it is really difficult for substances to actually penetrate into the skin. And the area where all the magic happens is the dermis. So you've got 3 skin layers: the epidermis, which is the outer layer; the dermis, where the collagen gets produced, where all the fibroblasts sits, which is the area which, when we lose our collagen, results in wrinkles. And then you've got the hypodermis, or the subcutis, which is the fatty layer. So really, any effective skincare product to make a difference long term or reverse signs of aging needs to go and penetrate into the dermis. Now, a lot of them can't do that because the particle size are just too big. And the only product, not the only product, one of the few products that has been studied for a long, long time belongs to the group of retinoids. So retinoids are a group of chemicals that basically get converted into retinoic acid in the end. That's the final product, and that can either be done in the skin, or you can directly put that onto the skin. So if it's really strong, then it tends to be, so tretinoic acid or tretinoin is usually prescription strength and needs to be prescribed by a dermatologist, and that has been shown to stimulate collagen production, to increase skin thickness, and to reduce the appearance of lines and wrinkles long term. So it actually gets rid of wrinkles very successfully. But the stronger or the more concentrated, or the closer the molecule is to retinoic acid, the more side effects you might experience, and that could result in peeling and exfoliation and redness. It's also something called retinoid dermatitis, which looks a bit like eczema if you overdo it. So if you use a very strong product, it should be done under supervision by a consultant dermatologist, and you might really initially only start with once a week, applying it once a week, and then building it up as your skin gets used to it. There are over-the-counter products that contain a precursor to the stronger version of the molecule, and these are usually retinol. So retinol is a precursor that can be bought in a skin cream over the counter. It's a much weaker retinoid, But when you apply it, the skin can convert it in several steps to the active molecule that then helps with wrinkles. The problem is, yes, it works, but the problem, as I mentioned before, is that in order for the cream not to result in side effects like redness and flaky skin, often when you buy retinol containing creams, they are not strong enough to make a difference, because if they do, and let's say you wake up in the morning and your skin is very dry and flaky, what do you think? You think, well, I'm probably allergic to it, I'm going to stop using that cream. But actually it may also be the result of the cream doing its job, exfoliating, increasing cell turnover, getting rid of old skin cells, shedding them, and so on. So I think if you're new to retinoids, you need to be prepared to wait for the result, be patient, not overuse it if you use a very strong product, and then also not be prepared for side effects. And I think if you want something really worthwhile that really works, it is best to do this with a dermatologist consultant. There are some companies, I'm really reluctant to endorse companies, but there are some really good companies that do quite good medical grade products nowadays. That they're not Nivea. Nivea, for example, is just or Boots No. 7, they also have retinol products. It's fine, but they will not be the miracle that you are after, Danny. they will take too long to make any difference. I'm not saying they don't work, but it just will take too long. If you want quick results, or fairly quick results over several months, and results that are actually consistent and persistent, and then you need to look at prescription strength stuff.
That is so interesting, because I looked at retinols, and some of the little bottles you can buy with I think 3% or 5%, they come in different strengths. And I never really, when you look at these things as a consumer, you never really know what is it that you're looking at. You never really know how much to take. And then people are often not very consistent, me, myself included. I think I opened a bottle. I didn't think it was doing much. And then I sort of left it a little bit, like you said earlier, when you don't really understand what you're doing. But it's great to know that this is a product that can be really, really helpful.
Very good, yeah. And if you have found a product that states on the bottle, use it once a week to start with, then follow the advice of the manufacturer. So if they declare the percentage of the active ingredient, and if they recommend to introduce it once a week, then do follow their advice. Because it's there for a reason. They have developed it to work, but also to prevent side effects. Then you just need to follow the guidance and introduce your skin slowly to it. And once your skin is more used to it, you can increase the frequency you use it. So I think that's always a good sign. Not all skincare companies do clinical trials. Most of them don't. So they buy in the ingredients that are based on clinical trials, and that's all very good. And be careful if you have a company that says, in consumer trials it has been shown to reduce wrinkles by 80%. Well, if you read the small print, often it's only 20 women, and it's their perception, and they were paid to be in the trial, or they got freebies for it. So this is not a clinical trial. This is a consumer study. That's not the same as a clinical trial that is independent and randomized.
Sometimes when I was sort of looking back to after my initial cancer diagnosis and treatment, I became very cautious about what I put on my skin. A really lovely integrative medical doctor said to me once, well, your biggest organ is your skin. And so maybe don't put loads of lather yourself in lots of moisturizers that contain lots of maybe ingredients that you don't need to have on your skin. So I was always very cautious about the products I put on my skin. I really like natural skincare and body lotions, because that makes me just feel good anyway. But I often worry, would something like retinol, would that be okay for someone who's had cancer? Are there any studies even to look at? Or, if you're 5 years, 10 years after a cancer diagnosis, do you still need to worry about products like that? Or
I don't think so. So anything that can be bought over the counter that you apply to your skin, I think that doesn't come with a warning, should be absolutely fine. So the one product where in America there was a company that tried to launch one, contained phytoestrogens at a very potent in a strength, and they had to abandon this because the FDA wouldn't approve it, because they couldn't show that it was safe long term on the endometrium, for example. If you use transdermal estrogen, you have to take a progesterone if you have a womb, if you have to take HRT, and it would have cost them so much money to show that their product was safe because it contained very high strength phytoestrogens. And we do know that potentially phytoestrogens, if they apply to the skin, we know from topical estrogen applied to the skin, same with topical estrogen applied to your vagina. If it works for your vulva and vagina, why on earth does it not work for your skin? Of course it would work for your skin, right? It's not a mucous membrane, but we do know that topically applied estrogen can increase skin moisture and reduce the appearance of wrinkles. But to do a clinical trial, to launch a product, then we have this conundrum. Is it a medical product that should only be available on prescription, or could it be available over the counter? So if you had, estrogen positive breast cancer, I would absolutely not use a product widespread on the face that contains even low dose estrogen if your consultant advised you not to have any estrogen. So that is the only product I would say. We do know that vaginal products like estriol cream in some countries is used by women on their face. Some women use it under their eyes because it reduces fine lines and wrinkles. But I'm not advocating that. We need clinical trials. We need big studies to show that these are safe. But retinoids, for example, I'm not aware of any study that has been done to show safety in breast cancer survivors. However, I would say there's absolutely no logical reasoning to say it couldn't be used. There's no reason whatsoever. It's just a vitamin A derivative. So it's just vitamin A that you need anyway through food. So if you eat a carrot, you get vitamin A. There's no reason whatsoever why you can't use this product. Same with sunscreens. You can use sunscreens. I would probably opt for mineral sunscreens because they are shown to not penetrate so deep into the skin potentially. Now everyone's scared about nanoparticles, but there's absolutely no evidence that nanoparticles in mineral sunscreen, which are mainly based on titanium dioxide or zinc oxide. So these are the ones that are derived from mineral oxides like zinc or titanium oxide. They are much more elegant if they come in the nano version. So they're very finely milled and ground down so that they don't leave a white cast. And actually they work much better in the nano version as a sunscreen because you don't have so many gaps when you apply them. So if the molecule is very large and you apply the sunscreen, then it leaves larger gaps between the skin where the rays can cause damage. So if you have the nano version, it is much more elegant, but also works potentially much better. So if you're worried about things going into the skin, I would probably think that the mineral sunscreen options are, I don't want to use the word safer, but less likely to be going into the skin. There are some old-fashioned sunscreens that we know have potential hormone disrupting properties at very high doses. Usually these trials were done in animals and rats and not humans. So at the end of the day, the sunscreens that are available in Europe and Australia, these countries have very, very high standards before a sunscreen can be launched. These products are likely safe for all of us, including breast cancer survivors. You can really overthink this. And I think more harm is done by not applying sunscreen than by applying sunscreen. Particularly if you're worried about wrinkles,
thank you so much. That's great. I do think sometimes I have overthought a lot of things in the past. And sometimes that overthinking that makes you then procrastinate, maybe not take action, like you say. Maybe people put less sunscreen on even because they're worried about what type. Everything you're saying, I almost need to sort of press pause, take my notepad and pen out. And I wonder if people at home listening to this do the same. You have so much information at the moment. I'm like, wow, if we speak again in a few months' time, Mandy, I'm not saying I would have used my vaginal estrogen on my eyes because I know you're not advocating. But I'm suddenly, like,
please don't.
No. But I'm just suddenly like, wow, my mind is blown to everything. Of course, is happening in America. It's different to Europe. I know a lot of American pharmacies where, yes, people put estrogen onto their face. Like there's so much happening in the quest to feel better in our skin, to look better. And so it's so important to get the right information from the right person. And I love that you're not mentioning brands. And if we ever bring a really good brand on board, Mandy, we should get them to sponsor Ada podcast and you for your book and the work you're doing.
I did
we're not going to mention
brand, but Vaseline
I know, but that's
it's so cheap that I don't feel bad about it.
It's so cheap.
I mean, we can call it liquid paraffin, or we could call it petrolatum jelly.
But if we ever had
Vaseline is very pure and clean, so I don't have a problem with them. I know there are Boots' own brand does the liquid paraffin as well. But Vaseline as a brand has been around for so long, and I think it's a trustworthy brand because they produce medical grade filtered product that we can even put in burn wounds. When someone is burned, to prevent water loss from a wound, you can put Vaseline on that wound. So this is how well it works. It's really excellent for dry skin to keep the moisture locked in.
Anyway, Mandy, we're no influencers on social media, and even if we had an affiliate link for Vaseline, we would probably earn about 1p. Because it's such a cheap product. So
Absolutely.
We're not going to go down that route. Mandy, do I need collagen? I've been really wondering for my skin. When I had joint ache, collagen came up and I spoke to doctors about collagen. Collagen is everywhere. It's following me around. I have an amazing brand literally stalking me on social media, telling me buy. Do I need collagen for my skin?
Do you need it? So I would say the women out there who have just bought a collagen supplement, you know what? Give it a go. Try it. Take it if you think you want to give it a go. I have absolutely no problem with it. It is slightly safe. And again, breast cancer survivors, we have no clinical trials how it will work for them or not. But actually, in that particular group, it may well be much more effective than in a woman who is not a breast cancer survivor, who's not on anti-hormone drugs, aromatase inhibitors, for example. So it would be great if we had a lovely study, and with all likelihood, it is not harmful. So if you have bought it, do use it up and then make an informed choice about 3 months later. So I have to say, with these products, you would have to take them for about 3 months to see a difference. But what I would also say, it's poor value for money. I think it is very much overhyped at the moment. There's an industry at the moment, a little bit like the menopause industry, where you have certain products that are oversold to women, and then there are women who have a fear of missing out because they can't have it, because on every street corner they're being told how amazing estrogen is, but not all women can have estrogen or get on with it, or sometimes it's contraindicated. So there's this fear of missing out, and I think the same at the moment happens with collagen supplements. And I've looked at the studies, and there are two problems. The first problem is that most studies are done by the companies who produce the collagen. So they found a benefit. Would they have published a study if they hadn't seen benefits? No, probably not. They have an interest. There's some bias. So, and this is one problem. So and there's also, you have to look at, why do you want to take collagen? There's more positive benefits for joints and muscles, but this type of collagen is more type 2 collagen. So if you buy collagen for skin and hair, you usually have type 1 and 3 predominantly with the amino acid composition. Whereas for joints and muscles, where there is slightly better evidence that it works for joint and muscle kind of aches, that you would have to focus on more type 2 collagen. So there are two different issues. There's the skin and hair, but there's type 2 collagen for joint and muscle. So there are different companies offering different things. But at the end of the day, what is collagen? Really, it is they're cut off, or it's a byproduct of the animal industry, either from fish or from poultry, pork, or beef, where they take the ligaments, the tendons, the collagen, the skin from these animals, they boil them down, they hydrolyze this. So hydrolyzing means they break up the collagen in these byproducts from animal farming, and boil them down, making them very small. And the smaller the particles, so when it comes down to peptides, these are the tiniest little molecules that make up proteins. The argument is that these tiny peptides get absorbed through the gut much easier than if you were eating an egg, for example. But so saying that the clinical trials that have been published have shown an improvement in skin moisture, fine lines and wrinkles, but the benefits are so tiny, so small, and we are not very clear on how much we have to use for how long and what brand, what type, is it the beef or the marine collagen, that it is very poor value for money. I think if you have the choice between a really good quality sunscreen that you can just about afford and a 3 times more expensive collagen supplement that costs you a lot of money each month, I would say buy the sunscreen and take the money you save and have a lovely day out, because it is probably poor value for money. That's what I would say. But at the same time, I don't blame anyone who wants to give it a go. Now, anecdotally, women may feel better, but maybe it's also to do with, so if you drink collagen, you have to stir it in a glass of water, and the water will moisturize your skin. By drinking, a pint of water in a day, and a lot of these supplements have added vitamins. So if you have a poor diet and you suddenly get some lovely vitamin C and some vitamin D and some vitamin E, then they will all be beneficial for your skin. We don't really know, is it the actual collagen that does improve your skin moisture, or is it the added vitamins in the collagen supplement? And the one thing I would categorically ask you not to buy are capsules or tablets, because we do know that they're way too small in terms of the dose of the collagen they contain to make a huge difference. So, if you have a collagen supplement that comes in capsules, you probably would have to take 10 of those to even have an effective dose. So they are categorically not working, in my view. The best ones, if you wanted to try them, were the ones that come in powder form. So if you look at, having to take 2 tablespoons daily, that's a lot of powder. And if you look at the capsules, they're tiny, so they probably contain half a teaspoon each, if that at all. So the dose is way too small. It's a complete rip-off. So that I don't like. However, if they also contain vitamins, then it's probably the vitamins that make the difference and not the collagen. I mean, I would honestly say I've personally tried collagen supplements. I've seen no difference. I focus more on healthy eating now. I focus more on getting my protein intake right. I eat eggs. I focus more on hydration. And so I think I got fed up with taking collagen every day. And also I read one study that really upset me, where in America they found, they looked at 20 collagen supplements, and they found they all had contained heavy metals like mercury, arsenic and lead. And they said, well, these levels were all below the safety standards. So these products were all safe, but they said, what if a woman thinks the more the merrier? What if she takes 3 times the recommended amount of collagen because she puts it in every single smoothie? Would she, if she did that over several years, accumulate these heavy metals? We just don't know. We don't know where these products come from. Often companies are not very transparent. They're very concentrated cut-offs of animals that we wouldn't just eat on its own. We would eat the whole chicken thigh, with the skin on. That's collagen. We wouldn't just eat the skin, and that's a bit odd. Yeah. So that is something that did concern me. I didn't put that in the book, but we just don't know,
And it really brings me to my last question, because it's the unregulated market, isn't it, of all of the supplements market. But it also brings me to the last a supplement. Is there one? So I know we spoke about collagen, but is there like you touched on it, multivitamins, a supplement, or biotin? Is there another supplement we need? Because it's a very divisive conversation, right? Some people say no supplements work. Pointless in taking multivitamins. It's pointless. You weed all out. It's expensive money. And then other people, and I work with so many functional medicine doctors who really believe that supplements in the right, or vitamins in the right patient can really make a really big difference. Is there a vitamin or a mineral that we could take as a supplement that might be really helpful for my skin's appearance, for that moisture, for maybe fine lines and wrinkles?
Yeah. So I quite like magnesium glycinate, because one of the other big factors for good skin health is sleep. So if you had a good night's sleep, we all wake up with the most beautiful, really refreshed skin. So if your sleep is really good, it makes a difference. More than the most expensive skin cream. If you had 8 hours solid sleep, you look great. Everyone does. So magnesium is really great, because magnesium is a muscle. This is safe for everyone. Most of us would not have a problem with magnesium. And I think glycine is another really good amino acid. So I take glycine, but I also take magnesium glycinate because it helps me with my sleep. And glycine has a calming effect. And if you also, the other really big component for skin aging is stress. So cortisol, stress is really harmful for the skin. We all know we break out with pimples and spots if we're stressed. So the combination of sleep and stress is really bad. So anything that can address that will help your skin from the inside. I do like magnesium. I do like magnesium glycinate. I personally take a little bit of, I like green tea. If you don't want to take the green tea extract, but drinking green tea as a herbal tea is full of antioxidants. And the other really good supplement that you might also try is cocoa powder. So there was a study that showed cocoa powder, so because it's very rich in flavanol. I hope I say that correctly, flavanols. So these are a form of natural compounds, a bit like these are phytonutrients that are really beneficial for our overall health. And there was a study that looked at cocoa powder, and it really helped with wrinkles and moisture levels in the skin. And who doesn't like a hot chocolate, or who doesn't like a cocoa powder in a smoothie? So, and it was also rich in magnesium. So all these phytonutrients that we see in food, like berries, red, purple foods, they're full of these antioxidants. And cocoa powder is one thing that you may want to try as a supplement, and I think super safe. 100% cocoa powder doesn't even have lots of calories, if any. I would say it's better in the morning because it can be a stimulant. So if you want to go to the gym and put it in your smoothie, perfectly fine. This is something you could really try. Sometimes we have to be careful with antioxidants in breast cancer survivors, because I believe that astaxanthin is not always recommended, because we haven't got enough clinical research about the interaction of cancer cells and high strength antioxidants. So I do like astaxanthin, which has got some evidence for skin and hair, and also resveratrol. But I would be careful with that. I would ask the oncologist, if you are a breast cancer survivor, whether you can take it or not, because there are some studies that say we should not give them or recommend them in a concentrated version to women who had breast cancer. But you can certainly eat red grapes. The skin of red grapes are very, very healthy, organic, if preferably, not kind of with covered in pesticides and so on. But magnesium and glycine is something that I really love. And obviously, if you want to avoid the direct sun exposure, you should take vitamin D as well, in the winter month anyway.
I don't know how anyone else feels at home now, but I'm like I can't wait to get off this call, which is weird because I want to go onto Amazon or onto like places, and I want to just stock up. I feel so empowered. This is like the most no-nonsense conversation, Mandy, I had about my skin probably in my whole of being an adult woman. And I've got 3 teenagers at home, and all they talk about, my girls, is skincare routines and skin and this and that. But the cleansing routine, that was really so interesting. The moisturizers, the retinol, we talked collagen, sunscreen, magnesium glycinate, all the way to cocoa powder, green tea, antioxidants, and vitamin D. There are so much in there, and I feel like I've got to go and stock up. I feel like I really want to go and really relook at all of my. No, I know, no, I don't. But like I had run out of magnesium for a long time, and in the evening I'm like, oh, where is my magnesium? And I just need to make time to go back to the basics sometimes, and to do the things that are really good for me. Mandy, I can't tell you how brilliant this conversation was. Do you think we can do another one maybe in a few weeks or a few months' time? I know there are many questions, and I would love to know from people at home actually what they felt we haven't been able to cover today. It's obviously a huge topic, and I always wanted to tackle it with integrity, staying away from brands, and I'm so grateful that I was able to do that with you today, so thank you for that. And I would love to know from people what questions they had. Did they want to know more about maybe some of the medical treatments? Did they want to know more about, I don't know, some other creams or serums or other things we haven't been able to discuss? And then please email us, reach out to us, and we'll hope to get Mandy back onto the show another day. Thank you, Mandy. Everyone go and buy the book. Maybe that's what we need to do in the meantime. Go and buy the book. I'm going to link it in the show notes.
Hair and nails. So that's something that comes up as well. Hair loss, hair thinning, and nail health as well.
Yeah. So we're going to read the book and then come with
Thank
all
you.
of our open burning questions back to you. Mandy, it was absolutely a privilege and an honor. And thank you for being not just a brilliant doctor, but also translating that into 2 really good books that are so great to read for us people out there. So thank you, Mandy.
Well,
You're
thank you for having
amazing.
me, Danny. It's a pleasure.
What an absolutely brilliant conversation. There are so many more questions I have, and I really hope that we can get Mandy onto the show in the future. One thing that resonates so much with me is when I moved to an oil-based cleanser. That was really a game changer for me. My skin is so dry. I do really feel like a prune. But when I moved to an oil-based cleanser in the evening, that just makes me feel quite nourished. I like her idea of layering up, and even the trick of Vaseline, like I think that's genius, and I'm definitely going to try it. But you know what I also really like? The addition of cacao powder, green tea, and antioxidants in food forms to really help and boost my skin. And of course, you know, the all important vitamin D. I love Mandy's hacks, her layering, her no nonsense approach to saving your money on expensive moisturizers. And I might go back and explore a bit of that retinol. I also really loved how Mandy was so non-judgmental, and I think perhaps I judge myself most when it comes to my appearance and to other people's appearance. And there were so many different pieces of nuggets in this conversation. It's hard, isn't it, to age as a woman, or anyway, I feel it's not easy. And it's so good to have these conversations. I don't think anyone will ever be right or wrong, but everyone has to find their own way. And that doesn't mean it's the easiest way for you, but a way where you feel a little bit better in your own skin. Anyway, lots of food for thought in this conversation. I hope it's been really useful. We're definitely going to talk more. I've also got a new brand of product that I will share with you on the podcast soon, because it's just been so lovely for me to smother myself in these healing balms. And I will share that brand with you on the podcast soon. But for now, I wish you a really good rest of the week. Thank you for tuning in as always. Make sure you subscribe to the podcast so that you never miss an episode. Skip the episodes that aren't relevant to you and tune into the ones that are relevant. And please go back to all of the other episodes on the show, because we have over 100 episodes and there is so much learning in these episodes for you. On your journey to recover and heal and grow and move into that personal growth as a cancer survivor, I'm with you along the way, and I wish you so much luck and all the best. Chat to you next week.